All right, well, I think we'll get started. So welcome everybody to the WCB webinar. Thank you for your interest. My name is Jamie O'Kane. I'm the Farm Safety Coordinator with Farm Safety Nova Scotia. I'm joined here today with Chris Mann, who's a Relationship Manager with the WCB, as well as Kyle Smith, who is a junior for the WCB. We're going to be presenting you a PowerPoint that they have on the WCB. We have some questions for them to answer at the end, but if you have a question that comes up during the presentation, feel free to enter it into the chat, raise your hand, or speak up and ask it out loud, and they'll answer your question as they go. And other than that, without further ado, I'll let them introduce themselves and take it from here.
That's great. Thanks so much, Jamie. Just had to get off mute there. So good afternoon, everyone. As Jamie said, my name's Chris Mann. I'm a relationship manager with Workers' Compensation Board Nova Scotia. So I've been with Workers' Compensation Board since October of 2022. I'll just let my colleague Kyle introduce himself as well, and then we'll jump into the presentation.
Hi, everybody. I appreciate you guys joining. I'm Kyle Smith. I'm a caseworker with Workers' Compensation. I've been with the board for 11 years now.
Great, thanks, Kyle. So Jamie, if you want to throw up the presentation up on the screen there, we'll get rolling.
Sure.
Great, thanks so much.
Mm-hmm.
Good?
Good.
Yeah.
Good to go.
Okay, great. Thank you. So as Kyle said, thanks everyone for joining it. And one thing that I'll reiterate to Jamie's point, this is very informal. This is basically for your benefit. So please, don't be polite and don't feel like you can't interrupt. Please go ahead and ask any questions. So from a WCB perspective, we have this kind of like presentation that we provide for all industries, basically a WCB 101. So I've kind of tailored it a little bit to the farming industry and agriculture. So Jamie, if you want to flip to the next slide for me. So what does WCB do? So WCB Nova Scotia works to keep Nova Scotians safe from workplace injuries. So our coverage is like other insurances that you would pay for that you're familiar with, like home and auto insurance. All registered employers pay into an accident fund, and all those costs are paid out through the fund. So any injuries that are done through WCB, those are paid through the fund that the employers pay through in premiums. So this is called a collective liability, and all the costs are shared amongst all the employers in different industries. So our main objective from a WCB perspective is hopefully to prevent injury if we can. But if there is an injury that takes place, because there are, accidents happen, we would look to work with employers and workers to get them back to work as soon as possible. So return to work is a huge philosophy that we own at WCB. And then we obviously talk about the prevention measures that can be done, but then also work hand in hand with the employers and workers to ensure that occupational health and safety is covered throughout all workplaces. So we have a wide variety of departments at WCB that cover claims administration and return to work. So some of the things that Kyle works on. We have an employer services department that worked in field services and account support. So they come out, they work with employers to set up a proper account and talk about their payroll that would go into the classification of setting up a WCB account, and then ultimately go into the rate setting of that account. And then we do a lot of things like injury prevention coaching, outreach and education and different resources, prevention campaigns on social media through our communication departments. And then also we partner with many industries and associations across Nova Scotia to ensure that that material and information is out there. So from a WCB perspective, this number always kind of changes. It's a moving target, but we cover approximately 353,000 workers and about 20,000 employers across Nova Scotia. So Jamie, you want to flip the slide? So who needs WCB coverage? So really, from an agriculture standpoint, it's not mandatory that you have WCB coverage, but there are other industries that it is mandatory required. So typically businesses that employ 3 or more employees, that classifies as a mandatory coverage for WCB. But when it comes to farming and agriculture, it's not mandatory, it's voluntary. So it's something that you can definitely apply for if you're looking to get some additional coverage. So when a business is registered with WCB, everyone working in the business is covered under the Workers' Compensation Act. So that's full-time, part-time, casual, and seasonal workers as well. So workers hired through an Employment and Skills Development Canada grant and subcontractors who do not have their own coverage are all covered under the employer's insurance. Employers who are self-employed or in partnership are not required to have coverage for themselves, but they must have coverage for their employers or for their workers, excuse me. So again, this isn't mandatory for agriculture and farming, but it's something that you can take part in voluntarily. There are exceptions for family coverage as well. So if a family member is living in a household and they're sole proprietor, partners, active officers, or whatever under one household, these family members are counted as workers. So that coverage can extend through them, but it's not mandatory. There's also, they're not covered under a regular account. So voluntary coverage is something that you can apply for. Jamie, next slide. So ultimately, what would be the benefit for someone in the farming industry and agriculture for coverage of WCB? So I'm just going to kind of reiterate the points that are on the PowerPoint. So the coverage for farmers would protect anyone against lawsuits or workplace injury, regardless who is at fault. A worker cannot sue a farmer if the farm has workers' compensation coverage. In return, for the worker, this receives insurance benefit for workplace injuries without question as who was at fault. If a farm worker can't work because of workplace injury, our WCB benefits can help. An injured worker is paid a percentage of the wages that they are earning before the injury. Initially, this is up to 75% of their take-home pay, plus all approved medical costs are paid as well. Next slide, Jamie. So improving safety and return to work is a team effort. So not only do we work with associations like Farm Safety, but it's also working with employers and other associations across Nova Scotia. So we know safety is a team effort. So we do our part to educate workers, employers, associations, government, what have you, to partner with them to ensure that education and the resources are out there from a prevention standpoint, but also for return to work. WC is not exclusive responsible for safety, but we're more like a catalyst or a driver to facilitate the right way to have a safety culture implemented. Next slide, Jamie. Perfect. Thank you. So just very high level, some of the service team that work within our WCB that work with large workplaces, small and medium. We have our health services team, and they partner with service providers across Nova Scotia to ensure that if an injury does take place, there's clinics around Nova Scotia for physiotherapy, chiropractor that would take care of those injuries for you. So we have different portfolios that are spread across WCB. So I'm a relationship manager for wholesale and utility that would cover agriculture and farming, construction, fishing, trucking, what have you. But then we have other portfolio manager or relationship managers in other portfolios, such as manufacturing, government and self-insured, healthcare, and we also have a team working up in Cape Breton as well. The workplace service teams cover all of Nova Scotia. So it goes from Cape Breton, Antigonish, Gosrow County, Pictou County, everywhere in Nova Scotia we cover. And then we also have a practice leadership team. And these are certified practice incentive leaders that work on educating people in the industry to ensure that we're providing the proper coaching to set up a proper safety culture for you. And we also, I should mention, have ergonomist consultants that come in and help with that coaching as well. Next slide, Jamie. So basically, one thing that we do Apologies. From a roles and support point of view, so we have a wide variety. So Kyle, as an adjudicator, would be considered a case manager that would look at servicing the claim when it happens. So if you have a claim that you call through to WCB for the coverage, Kyle would work with you amongst all of our case managers to ensure the proper service is provided throughout that claim. We have return to work assistants that work with our case managers to ensure that the proper pay is being done as well, and to follow up any kind of needed kind of appointments with any doctors, service providers, what have you. Jamie, I saw something flash up on a Q&A. Is that related to this slide?
Yes, we have a question.
Yep.
Are WCB benefits easier to access than regular WCB benefits? 78% of claims get denied. Or is the benefits for the farm owner so they can't be sued?
So I can kind of jump in on that. So
Sure.
if you have WCB coverage, an injured worker can't sue you. We act as the insurance person that gets them paid through medical benefits, et cetera. Now, there is a max wage that we do pay out. It's just over 72,000. So if they make over that, they are unfortunately capped. The WCB benefits easier to access than regular WCB benefits. I don't know what they're right. So if you're referring to the EI situation, I don't know what EI, but 78% of claims get denied. Maybe I need some clarification on that.
So
Do you understand that one, Chris? Yeah.
Yeah, so I'll jump in there because I do have a question on that as well. So from what we're told from a physical injury standpoint, about 97% of our claims are approved. About 3% of those claims are denied. So the 78%, I would have a question on that to actually, we can dive into that a little bit deeper because I'm not quite sure exactly what that's pertaining to, but not to say that it's wrong. It's just something that we can definitely follow up on. But I'll keep on going, and then if that person would like to kind of elaborate in the Q&A or in the chat, please do so, and then we'll circle back to that. So then jumping into further roles and responsibilities. So relationship manager. So I work closely with large workplaces, so large employers, working with them to kind of navigate the stream of WCB, how to not manage their claims, but how to kind of update their rates, look at information for educational point of views on preventing injuries, work with them on resources that they can educate their staff on return to work. And if it's a deeper dive that needs to be done, then I circle in a workplace consultant that can come in, work with an employer's JOS committee, and really kind of hammer in what kind of educational services are needed. And then our educational consultants can then provide training as well that might be able to help. And then our ergo team that comes in and actually does assessments of the works being done on the farm or in a workplace environment, and can assess whether it's within ergonomic approval or not. Next slide, Jamie. So really, I kind of stipulated part of my role is along the lines of injury prevention and what we can do. So really identifying trends. So from a WCB perspective, we get a lot of data, a lot of information, but it's always kind of in the past. So the injuries happen, the data comes to us and lets us know month on month how many claims are being processed, but we're able to look into that information and that data, and we can really dive into, what were the injuries, what caused them, and then we work with employers to kind of identify those issues and provide opportunities to say, here's something that we've seen as a trend. It could be in your industry, but it could also be as this one employer, here's some trends of injuries that we're seeing for you, and provide you some education and information on how to do that. Or like I said, circle in a workplace consultant or educational consultant to come in and help you with that, and then provide you with the opportunity for more resources and training, or connect you into potentially some work with our partners in labor skills and immigration as well. Next slide. So if an injury does occur, and Kyle, please jump in at any time, but if an injury does occur, obviously the first aid medical attention is the first thing you need. We do have a direct access that Kyle can kind of speak to as well. But the one thing that needs to be done is if an injury does occur in the workplace, and you do know that there is WCB coverage, or if you're an employer and you have the WCB coverage, it's really important to get that first aid medical attention right away and to provide any kind of documentation in that industry as well, or in that injury as well. Kyle, do you want to dive into the direct access piece as well?
Yeah, I mean, the good thing
I do have a question.
Oh, sorry about that.
Go
Yeah, go ahead.
And that was pertaining to the question earlier. So the question earlier, to repeat it, is, are WCB benefits easier to access than regular WCB benefits, with the note that 78% of claims get denied? Or is the benefits for the farm owner so they can't be sued? And now there's a follow-up to that question that I repeated, is it would be farm benefits versus regular benefits. And the comment is, I've not met anyone that has had a positive experience with WCB. If only 3% are denied, has the appeals process improved? So it's it sounds to me a question about the appeals process and the ease of access for WCB benefits.
Yeah, it's a great question. I mean, I don't know from a standpoint. I've only been here since 2022 from a percentage of the 97% approved and 3% decline. I don't know if there's something that's been done to make that easier so that they are approved. I do know that employers and workers are getting more educated in the right ways of getting help when needed, and those injuries are getting looked after right away. I can't speak to the service that you've been provided in the past, but it's something that we can definitely look into. So if it's something that you'd like to kind of reach out to Jamie, and Jamie can kind of connect you with me, we can look into kind of what the service was that you were provided and see if there's a way that we can ensure that that feedback's provided, or at least someone to get in touch with you if a claim was denied and not gone through to appeal, or the appeal didn't come back in your favor, and explaining that a little bit more. Kyle, I don't know if there's anything you wanted to add to that.
Yeah, I mean, the appeals process, unfortunately, as a caseworker, is out of my hands. I can dive into it deeper, but basically, I will review mechanism of injury versus medical received. So I will review all that. I would say that 3% is probably a little low. I would say it's probably a little higher and kind of being denied, at least that I see. And we also have board medical advisors that can review this stuff on questions that I have. Unfortunately, I mean, appeals will happen. It's two sides. The worker can appeal, the employer can appeal. Once it gets into that, I mean, I don't have a lot of appeals, but once it gets into their hands, unfortunately, it is out of our control. So I can't speak if it's improved or not. I don't see a lot. A lot of the decisions are upheld based on the initial decision, but as far as has it improved, I can't truly speak to that, where it's a separate kind of entity.
Yeah, it'd really be a claim by claim basis as well. So it's
100%.
difficult to do like a wide brush stroke to say that this is one way or the other. It would be each claim. And obviously Kyle and I are on a certain team. Like I said, there are other portfolios in there. So there could be a little bit of a different kind of feedback on that. But again, please reach out to Jamie, and Jamie can get in touch with me, and then we can kind of look into that process and that service that you're provided. 100%.
I can touch base on the direct access there, Chris, if that's where we're going.
Yeah, please go ahead.
Yeah. So one of the good things is, again, with the WCB coverage access or coverage, is that we do have direct access. And what that is, that's preferred providers with contracts with WCB that you guys can send to physiotherapy, chiro, etc. So when initial accident happens, if they're not obviously fractures, breaks, bleeding, that kind of situation, strain, sprain, which are the common injuries, you guys can send them to physiotherapy, a clinic that we use. And again, the list can be provided. No questions asked. If the claim's been approved or denied, it doesn't matter. The initial assessment's always covered. So even if a claim, you haven't even sent the action report, get these people off to physio if need be. That is just a general approval that will go to the pod if the claim is denied. So the kind of no need to wait on a claim decision. But the good news is we have some strong physio clinics in areas where farms are in existence that have a return to work focus as well. So again, something we can always work on with return to work, transitional duties as far as keeping people in the workplace, which is the ultimate goal. But the good news, as I said, a lot of these physio clinics have that focus in these kind of niche areas.
Great, thanks, Kyle. Jamie, if you want to flip ahead there to the next slide. So this is also this is our online portal that we use. It's called My Account. So both employers and workers have access to My Account. And this is a way that you can also get in touch with your case manager. So it's a secure online business tool for all employers. So it's 24/7. You can access it at any time. From an employer standpoint, you can access your account and look at, your costs, trends, if you will, as well. But then from a worker, you can also be sending in messages, documents to your caseworker. All our WCB injury reports come in and any related documents from, your medical team, they all come in under this one tool and they save under your claim. And then there's cleared status for businesses and for subcontractors that an employer can provide. And there's a bunch of information from a rate point of view, your monthly account, payroll, what have you, from an employer standpoint that you can access as well. So this is a tool that, we use every day that we can access for employers and their workers as well to communicate about the claim, to keep up to date, and then also to provide any information related to your claim. Next slide. So, Kyle, this might be something that you can touch on as well, but like ongoing case management. So once a claim has kind of been accepted, how that happens and being processed is done by the case manager or the caseworker. There are a lot of different avenues that this could go, like phone calls, case conferences, where you have a meeting with the case manager, the service provider, the worker, or the employer to kind of outset a timeline of return to work and how to ensure that we get this worker back to work as soon as possible.
Yeah, just to kind of jump in on that. So if it's a strain type injury, we get them off the physiotherapy. 2 to 4 weeks kind of is the gauge that we have. If this person's not going to return back to their regular duties, we'll set aside a meeting with the employer, the worker, the treating physiotherapy team, OT, whatever is needed, just to kind of make sure we have a game plan in place. If physiotherapy is kind of maybe not the avenue, we do at WCB have some expedited services as far as imaging goes, MRIs, specialist consultation. Again, as I mentioned, we have a board medical advisor that can help navigate claim specifics, mechanisms of injury, just to confirm findings opposed to, say, pre-existing and stuff like that. So there is kind of a structure in place once an injured worker gets into our medical system as far as physiotherapy and all that kind of stuff. And we do have avenues to help fast track things outside the public.
Great. Thanks, Kyle. So I just want to be mindful of time. We're about 5 minutes out to 1 o'clock, and I know this ends at 1. So I want to just kind of quickly touch on the last 2 slides. Basically, just kind of highlighting some of the things that we can do from an employer's return to work program and the aids that we're able to provide to get that worker back to work, but also mitigate costs to the employer. And just quickly to the last slide there, Jamie, because I want to leave some time for questions as well. So the WCB resources, we have a huge amount of resources that we can provide to employers and workers on how to navigate their claims, provide prevention for those claims as well, or accidents, and then also resources on like psychological healthy workplaces, and then navigating working to well and returning to work and what have you. So I know I'm kind of just speeding through this, but I do want to provide time for further questions or any kind of conversation as well. And Jamie, I know you brought in a couple of questions that people have sent in just prior to registering, so I want to cover those if we can.
Sure. So thank you both for answering questions on the fly. Now I have some questions that were asked by our members in the registration form, and these are both very good questions. The first is, are all injuries covered now or only visible injuries?
Do you
So
want
it's
to
not
take
just
it, Kyle? Yeah.
Yeah, absolutely. So visible ones I'd say are the probably the most common as far as strains, sprains, and stuff like that. Fractures, breaks, stuff like that. But there's also the psychological component. There's PTSD and that kind of stuff that can jump in, and that's handled by a specialized team. Myself, Chris, and Wholesale, we handle more of the, I guess, the visible things, but it again includes anything from strains, sprains, cuts, fractures, amputations, all that kind of stuff. So to answer the question, yeah, I mean, it's not just visible ones that are covered.
And this question is pertaining to mental health as well. So a follow-up to the question is, does WCB provide any coverage or recognition for mental health?
So we're currently in it's been announced from a Nova Scotia legislation point of view that we are going to be covering gradual onset psychological injury. So that legislation will be going live in September. So we have a whole team that is going to be dedicated to psychological injury. That from a mental health standpoint, the psychological injury that's going to be in place from a policy point of view or legislation for WCB, that's ultimately going to be covering workplace harassment, bullying, and sexual harassment as well. So that really is covered from the psychological standpoint. From a mental health standpoint, this team, as we're kind of building this out, and I'm being told will be provided resources that can be available. But right now, the coverage from psychological injury is going to be more focused on the harassment and bullying in a workplace point of view. And I know mental health is a huge kind of topic kind of thing. So it really right now it's going to be focused on that. But that's not to say like currently if there's an underlying psychological injury from a physical injury, if there's PTSD or a concussion, we do have coverage for that. But outside of the psychological, that's something that'll be coming down the pipe come September.
So thank you both for your answers on that. Very informative for the question. I do have one that popped up in the Q&A, and then I still have one to cover from the registration.
Sure.
So the one that popped up in the Q&A is post-concussion covered? It's not always noticed at time of injury.
Yeah, so I'll just jump on that. I would say it is. Well, obviously with supporting medical, there's a team that does review that. So as we know with concussions, that they don't always present themselves right away. So yes, there is coverage as long as they're supporting medical, and that caseworker would review that on a per case basis. But as long as it kind of syncs up, then yes, absolutely.
And would that pertain to any injury, Kyle? If there's an initial injury and that develops into something that needs extra attention, does that pertain to the same thing?
It would have to be supported by the mechanism of injury. So say a fall where maybe you strike your upper back shoulder, but your head snaps back, and that can kind of lead to a concussion, but not maybe is not the primary focus of the time because maybe you have a fractured shoulder or laceration, stuff like that. So yeah, it is in the end, but again, it has to go back to the mechanism of injury, which is reviewed.
Okay. Thank you. And the next question is, this is the first time I've been hiring seasonal local labor. How do I get started with WCB, and is it necessary for a seasonal part-time worker?
Yes. So to get started with WCB, 100%, it's voluntary for agriculture industry and farming industry. So you can just reach out to us. There is a 1-800 number that would provide you with what you would need to provide to get that coverage. From a seasonal standpoint, yes, they would need coverage. Typically, if it's a seasonal worker, it was kind of pointed out in the slideshow earlier. If the employer does have WCB coverage, the seasonal worker would be covered for that, included in that coverage. If the employer does not have WCB coverage, and say like a contractor comes in, typically you're going to want that subcontractor to have their own WCB coverage. And that's something you can ask for proof. But before we jumped on this webinar, Kyle kind of reiterated, anytime you have anybody doing any work with you, whether you're a homeowner and getting your roof repaired or what have you, you want to ensure those workers have WCB coverage, and you can ask for that coverage to be shown. So, Kyle, do you want to add to that at all?
Yeah, just a quick. I mean, I think that's probably one of the most important takeaways. Just knowing how the again, people coming going out of a farm situation, always ask for clearance letters, and if they have WCB coverage, even if again, farms aren't required to have WCB. But if a worker comes on your site and it's not asked, or he doesn't have WCB and he gets injured, that can follow up and open up to a lawsuit on your farm or on your business. So it's, again, simple ask: do you have WCB coverage? Ask for the proof. They can provide that to you where they are coming from an outside source.
And I'm just going to jump in one other thing about getting in touch with WCB as well. So we've provided the farm safety with one of our brochures, so that you guys have access to that, and that provides our contact information. So I believe, Jamie, you might have linked it up with the invite, and I know it's housed somewhere on the website as well. So that's something you can access to get the right numbers of who to call and get that coverage.
We have one more question if you folks both have time.
Absolutely.
Yep, go ahead.
Okay. Do you have examples of any costs that uninsured farms have had to incur due to injury of an employee? It's difficult to comprehend a number.
Yeah, that's a great question, and I do not, but that doesn't mean I can't get it. So the one thing is, as I mentioned earlier, we have an employer services team. So that would be a question that I would ask to them. So that's something I can follow up with them. And Jamie, if you want to kind of just notate who asked that question, we can provide them with some information. I will be honest, I don't know how many people in the farming industry do have coverage where it isn't mandatory. So it's something that hopefully we can provide you with an example as a hypothetical cost of what that is. But we can definitely circle back and provide you with that information. It's a great question.
Yeah, they've all been great questions. We've had some great discussion. Is there anything else that anybody would like to ask while we're here and you have the opportunity?
Just before that might be coming into, Jamie, I wanted to reiterate like our thanks to Farm Safety for allowing us to kind of come on and chat with you folks today. And as we said, as Jamie and I were kind of preparing this is like the first step. So this is something that we want to ensure that a relationship is there. Yes, it's not mandatory, but we want to ensure that everyone is safe in the province, and we're happy to come back. I know Jamie's providing this as a recording. But we're happy to do more if there's an appetite for more webinars and more information. We are doing this virtually, but we're more than willing to come in and meet in person as well. So travel never scared us. So if it's something that we can come to you, provide you with some information, we're more than happy to do so as well. We just want to make sure everyone's safe, but thank you for this opportunity.
Oh, the pleasure is all ours. I found it very informative. We had some great discussion. Thank you, everybody, for your questions. If you do have a question that you think about later on, feel free to email me and I'll make sure that it gets to the right person to answer it for you. And other than that, thank you to Kyle and to Chris for the great presentation. And thanks again to all our participants. Is there anything else that you guys would like to say? Closing notes?
Just thank you. Appreciate it.
Yeah, no, appreciate it. And I said, any questions that come your way, Jamie, by all means, forward off to us. If we don't know the answer, we'll certainly find somebody that does and get a response back to you guys.
Sounds great. All right. Well, thank you, everybody. I hope that you found this a very informative webinar. And again, if you have any questions at all, feel free to reach out to me. And it looks like we're building a great relationship here. So thank you, everybody.
Take care.
Take care, guys.
Bye.